the socially isolated person having an older brain, that their brain looks older than you'd expect for a person their age.
Dr. O'Sullivan, what does loneliness do to the brain?
Loneliness is a stress to the brain. The body and the brain responds to loneliness in the way it responds to stress, with an elevation of stress hormones, inflammatory reactions in the body affecting the organs, and a disturbance in our immune response. And all of these things, over a long term, have a negative effect on brain functioning. And brain imaging and functional MRI studies, confirm this. Imaging shows that there is a reduction in the volume of important brain structures in lonely people, in socially isolated people. There's reduced level of brain activity in these structures. These are functions that govern social behaviour, intellectual functions, and emotional regulation. Over time, a person who is socially isolated, their brain ages prematurely.
And what about the effect of loneliness on the physical body?
The body responds to loneliness and social isolation as it would to a major stress. So the lonely person's body has to cope with years of stress caused by their living circumstances and their mental state. People who are socially isolated have a shorter life expectancy, and research shows that this shorter life expectancy is in the range of 30%, even 35%. The lonely person, because of perhaps personal neglect, faulty living habits, poor diet, lack of exercise, is much more at risk for heart disease, high blood pressure, stroke, diabetes, and of course depression and addictions. So all of these issues factor in and have a negative effect on their life. Often they resort to alcohol and drugs as a form of self-medication to deal with the symptoms, the distress symptoms that they have. And so in time, they develop addiction problems, depression, anxiety, fears and phobias. All of these become an additional burden to their physical health problems. It has been called the modern epidemic. And as I said earlier, it's now recognized as a major public health problem. It's a problem that's increasing in our society, and it's a problem that has serious consequences for our society unless it's dealt with, unless it's addressed. It's one of the major issues of modern times.
Could you talk about loneliness and social isolation?
Yeah, loneliness and social isolation are two terms that come up again and again in the literature, and they're referred to in research. We can have loneliness without social isolation. That can occur. Although, in my opinion, most lonely people are to some extent socially isolated. But there are some who are severely socially isolated. Where you have loneliness and severe social isolation coexisting, the detrimental effects of that combination is quite severe. And in situations like that, we're much more likely to see problems in terms of medical health, serious medical health problems, serious problems with brain functioning, intellectual decline, the premature onset of Alzheimer's disease, problems with memory, decision-making, and other intellectual activities. So it's a very important connection and to identify, to make, and to be aware that once social isolation becomes established and persistent, it does have a very significant effect on a person's mental health and physical health. and, if I can put it this way, life expectancy.
Thank you.